Hello, my friend. If you're over 50 or maybe in your 60s, 70s, or beyond, and you've noticed your blood pressure creeping up more than you'd like, or perhaps you've been feeling that extra tension in your body during stressful moments, you're certainly not alone. Many of us experience this as the years go by. The good news is, there are some very gentle, simple breathing practices that some people find really helpful for promoting a sense of calm and possibly supporting healthier blood pressure levels naturally, right from home, without any equipment. Today, I'll share 3 specific breathing approaches that research suggests may help in moments when you need to settle your system quickly and even with regular gentle practice over time. These are easy to try, and I'll walk you through each one slowly, with modifications so you can do them safely and comfortably. We'll take our time, step by step, and I'll remind you of ways to make them easier if needed. Let's get started together. Hello again, and welcome. I'm Dr. Sarah Truman, your health coach and wellness educator focused on helping folks just like you stay active, independent, and feeling good as we age. I'm not a medical doctor. This channel is all about general wellness education and practical lifestyle ideas, never medical advice or treatment. Everything I share today is for educational purposes only. Please always talk to your own doctor or healthcare provider before starting any new exercise routine, breathing practice, or making changes to your habits, especially if you have any health conditions like high blood pressure, heart concerns, lung issues, or if you're taking any medications. Your doctor knows your personal health history best, and nothing here replaces their professional guidance. If you're new here, thank you for joining me. If you've been with me before, it's so nice to see you again. Today's topic is something many of you have asked about: simple breathing techniques that may help support healthy blood pressure levels, particularly those quick, calming ones that some people use in the moment to feel more relaxed almost right away. As we get older, our bodies can become a bit more sensitive to stress, and everyday things like worry, sitting for long periods, or even just the natural changes in our blood vessels can contribute to higher readings on the blood pressure monitor. The beautiful thing is, our breath is always with us, free, and something we can gently guide to help our nervous system shift toward calm. Studies and experts suggest that slow, controlled breathing can activate our body's relaxation response, which may support lower blood pressure in some people by helping balance our heart rate and easing tension in the arteries. Everyone's body responds a little differently. What feels helpful for one person might need tweaking for another. But these are gentle practices worth exploring mindfully. Here's what we'll cover together today. First, we'll talk about why breathing matters so much for our blood pressure as we age. Then, I'll introduce 3 specific breathing hacks, simple patterns you can try right away. We'll go through each one carefully with step-by-step instructions, safety tips, and easier versions if you need them. After that, we'll touch on a few common mistakes people make with breathing practices, some important red flags to watch for, and finally wrap up with the key takeaways and how to make these part of your day gently. Sound good? Let's ease into this together. As we move through our 50s, 60s, and beyond, it's very common for blood pressure to shift a bit higher than it was in our younger years. Think of your blood vessels like flexible garden hoses that, over time, can lose a little of their stretchiness due to natural aging, occasional stress buildup, less daily movement, or even just the way our bodies handle salt and fluids differently now. When we're stressed, even low-level stress we don't always notice, our nervous system goes into a mild fight-or-flight mode, making our heart beat a little faster and our vessels tighten up some. That can push blood pressure up temporarily. The reverse is also true. When we help our body feel safe and relaxed, the opposite happens. Our heart rate can slow, vessels relax a bit, and for many people, blood pressure readings trend gentler. Research, including reviews from places like Harvard Health and various studies on slow breathing, suggests that practicing deep, slow breaths, especially around 5 to 10 breaths per minute, can help engage what's called the baroreflex, a natural system in our body that helps regulate blood pressure. It's like gently pressing a reset button on our stress response. Some studies show that even short sessions of slow breathing may bring down systolic pressure, the top number, by a noticeable amount for some folks, and regular practice over weeks can offer ongoing support. But please remember, this isn't a replacement for any medical care or prescribed treatments. It's a complementary habit that many find adds a sense of control and peace. You're not alone if you felt frustrated by fluctuating numbers or worried about what it means for your health. The encouraging part is that small, consistent breathing moments can often make a real difference in how we feel day to day, and they're so easy to fit in while watching TV, sitting in your favorite chair, or even lying in bed. Now let's move to our first breathing hack. This one is called diaphragmatic breathing or belly breathing, and it's often the foundation for many calming practices. Research suggests it may help lower blood pressure by encouraging deeper oxygen flow, relaxing the body, and reducing that tension we carry in our chest and shoulders. Here's why it can be so helpful in simple terms. When we breathe shallowly up in our chest, as many of us do when stressed, our body stays in a slightly alert state. Switching to belly breathing uses the diaphragm, that big dome-shaped muscle under your lungs, and it signals safety to your nervous system, helping slow your heart rate and possibly ease blood pressure. Many seniors find this one feels natural once they get the hang of it. Let's try it together. You can do this sitting comfortably in a chair with your feet flat on the floor, or even lying down if that feels better for your back. First, place one hand gently on your belly, just below your rib cage, and the other hand on your chest. Next, breathe in slowly through your nose for a count of about 4, letting your belly push out against your hand while keeping your chest mostly still. Imagine filling a balloon in your tummy. Then, exhale slowly through your mouth or nose for a count of 6 or longer if comfortable, feeling your belly gently fall back. Try to make the exhale a little longer than the inhale. That helps activate relaxation even more. Repeat this for 5 to 10 slow breaths to start. If sitting up feels tiring, lie on your back with a pillow under your knees. If you have trouble feeling the belly move, try it lying down first. Gravity helps. Hold onto the arms of your chair or place your hands on your lap for stability if needed. If at any point you feel lightheaded or uncomfortable, just return to your normal breathing and rest. Skip holding the breath if that doesn't feel right. Simply flow smoothly from inhale to exhale. Take your time. Even 3 or 4 good belly breaths can make a difference. You're doing wonderfully just by trying. Now that we've covered belly breathing, let's move to something a bit more structured. Our second hack is called resonant breathing, or coherent breathing, aiming for about 6 breaths per minute. Some studies, including ones on heart rate variability and blood pressure, show that this steady, slow pace can be particularly supportive for calming the system and may help bring down blood pressure over time with practice. The idea here is to breathe at a rate that syncs your heart and lungs in a harmonious rhythm, around 5 to 6 seconds in and 5 to 6 seconds out. It helps stimulate your body's natural relaxation pathways. You can do this seated or standing, whatever feels steady for you. If you're new to counting, don't worry, we'll keep it simple. First, get comfortable with your spine fairly straight but relaxed. Maybe rest your hands on your thighs. Next, inhale gently through your nose for a count of 5 seconds, letting your belly expand softly. Then, exhale through your nose or pursed lips for 5 seconds, letting everything release. Aim for smooth, even breaths, no forcing. If 5 seconds feels too long, start with 4 seconds in and 4 out, then gradually lengthen as it feels natural. A good cue is to think in calm, out calm. Practice for 5 minutes once or twice a day or whenever you feel tension building. For support, use a chair back or wall if balance is a concern. If counting distracts you, just focus on making inhales and exhales feel even and peaceful. No stopwatch needed. If you have any respiratory conditions like COPD, check with your doctor first, as slower patterns might need adjustment. Stop immediately if you feel dizzy, short of breath, or anything unusual. This is about gentle ease, not effort. Many people say they feel noticeably calmer after just a few minutes. Give yourself grace. It's okay if it takes a few tries to settle into the rhythm. Okay, this next one is really popular because it can feel almost instantly settling for many. Our third breathing hack is the 4-7-8 method, developed from ancient yoga practices and shared widely for relaxation. Some folks find it helps drop tension quickly, and research on similar controlled breathing patterns suggests it may support blood pressure management by promoting deep relaxation. It involves a longer exhale and a gentle breath hold, which can help slow your heart rate and ease your nervous system. Let's walk through it slowly. Sit comfortably or lie down. Many prefer this one in the evening to unwind. First, exhale completely through your mouth with a gentle whoosh sound to empty your lungs. Next, close your mouth and inhale quietly through your nose for a count of 4. Then, hold your breath for a count of 7. After that, exhale completely through your mouth for a count of 8, making that whoosh sound again. That's one cycle. Repeat 4 times to start. Don't do more than that at first. If holding for 7 feels too long, try a shorter hold like 4 or 5, or even skip the hold and just do a longer exhale. If you have any heart rhythm issues or feel uncomfortable holding your breath, please modify or skip this one until you talk to your doctor. Use a chair for support, keep your shoulders relaxed, and never force anything. If it makes you feel lightheaded, stop and breathe normally. The beauty of this one is that even a couple of cycles can bring a wave of calm. Take it easy. You're in control. Before we wrap up the main techniques, let's talk about a few common mistakes and myths I hear often. One myth is that you have to breathe perfectly or force deep breaths right away to see any benefit. Actually, the opposite is true. Gentle, consistent practice matters more than perfection. Start small and build comfort. Another common one is thinking these breathing exercises will instantly and permanently fix high blood pressure on their own. While they can provide quick calming and research shows promising support for regular use, they're best as part of a bigger picture, alongside healthy eating, movement, good sleep, and following your doctor's plan. No single habit is a cure-all, and results vary. Some people also push too hard, holding breaths too long, or breathing too fast, which can cause dizziness or tension. The key is slow and comfortable. Listen to your body. While these gentle breathing practices may help many people feel calmer and support healthier blood pressure as part of daily wellness, they're not a substitute for medical care. Please see your doctor right away if you experience any concerning symptoms, such as chest pain or pressure, sudden shortness of breath, severe dizziness or fainting, sudden weakness or numbness, especially on one side, severe headache, or any symptom that feels like an emergency to you. Trust your instincts. If something doesn't feel right, it's always better to get checked promptly. Your health and safety come first. Let's quickly recap what we covered today. First, we explored diaphragmatic or belly breathing, simple hand-on belly breaths to encourage relaxation and deeper calm. Second, resonant breathing at about 5 to 6 seconds in and out for that harmonious rhythm many find supportive. Third, the 4-7-8 pattern for a quick settling effect with its longer exhale. And we talked about why these may help, how to do them safely, and the importance of starting gently. Remember, you don't have to master all 3 today. Pick one that feels easiest, maybe just a few belly breaths while watching your favorite show, and build from there. Small steps add up over time, and progress looks different for everyone. Be patient and kind with yourself. You're already taking a positive step by being here. If you found this helpful, I'd be so grateful if you'd give the video a thumbs up. It really helps other seniors discover these gentle ideas. And if you're not subscribed yet, consider joining our community. I share new videos every week with simple ways to stay strong, mobile, and feeling good as we age. If you'd like to keep going, I recommend checking out my video on easy daily stretches for better circulation and relaxation. I'll put the link on screen and in the description below. Thank you so much for spending this time with me today. Take good care of yourself, breathe easy, and I'll see you in the next video. Warmest wishes.